Wow. Yeah, fantastic. Okay, thank you so much for turning on your video. Could you please turn on your camera? We want to see your beautiful face. And we need to interact in the class. Please turn on your camera and write in chat box from which country you are joining us, please. Okay, thank you. Donna from US, Florida. Mayam from Iran. Hello. Aisha from India. Aminia from Iran. Tahmina from Bangladesh. Yes, thank you so much. So, hello again, everybody. Welcome to our 13th class. I guess this is 13th class, class 21 and 22 of optimal birth. Today, we are going to discuss about management of breech, twin labor, plus we are going to talk neonatal resuscitation in your home birth. Today, we are with Gail Johnson, Master of Midwifery from US, Canada, and she's one of our consultants in a scientific committee in Lilly Excellence Center. Welcome, Gail. Let's start, and we have, yeah, thank you so much. Yes, over to you, please, Gail.
Well, hello. I'm glad to see all you ladies again. Some of you I've seen before, but I understand that there's some new midwives here and also some midwives that are thinking of starting their own practices. So that is going to be amazing. And to be honest, I'm jealous of you girls that are just starting everything, because this is going to be my 80th year and I can't quit. I just can't quit. And so I'm so jealous that I don't have another 40 years to start all over again and share all the wonderful experiences that you're going to have. Lily, do I need to slow down so you can translate sometimes?
Yeah, I think we don't need translation today because we want to save our time. And you can go to English, then I will have some supporting class later and translate everything later separately. Thank you so much.
Okay, Lily,
can you please introduce yourself, because we want, yeah, please, if you
okay,
can,
all right.
we can have a small bio from your beautiful background. Thank you.
Okay, yeah, I will introduce myself. My name is Gail Johnson. Right now I'm in Canada. I have been a midwife since I was in my 40s. So I've been a midwife for about 37 years. And I became a midwife because I saw births in hospitals that were not caring. You know, it's one thing to get medical care, and it's another thing to get caring. And I found out that the midwives have a more open heart. At least this is my experience, and that we want to help our fellow women, our fellow young people have better births. Birth is not an illness. This is something we must remember. I know you've all been medically trained. I know that you can help women very much. But it's not an illness, ladies. It's a natural, normal function of the body. And just as if we leave animals alone, you have to remember that we are animals too. And sometimes the things that we think we have to do to ensure a healthy mom and a healthy baby are not true. We interfere far too much in the birthing process. Most of the time, a woman just needs a caring, loving person to be with her. We have to understand how the body works, of course. We have to understand what we can do to facilitate that. And that's what's not taught in our normal training when we go to school. We are not taught how to encourage someone to find their own power, to find their own caring way of having their baby. And we want her to follow the protocols of the hospital. We want her to follow the thoughts that we think will give her the quickest or easiest birth. And to that end, we're causing a lot of trouble. Now, I know Lily wants me to talk a little bit about breaches and twins, but also you have to understand that breach is a variation of normal. I mean, there's lots of breech babies being born. Depending on how much time you have had the opportunity to even become involved in breech babies. When I was learning to do breeches, we would have an older midwife like myself now, and we would ask, as soon as she said she was going to do a breech delivery, all the midwives in the area wanted to come to that birth. And that's how we got our experience, by actually seeing and doing. We didn't just get theory about using a model. We didn't have models in those days. We didn't have all the videos in those days. So we had to go to an actual birth and see how it progressed and see how the mother did what she needed to do for helping her own baby out. So you have to get a lot of practical experience. And how you get that is you have to encourage people to have a breech birth, and then you have to allow and share those births with each other as much as you can, because that's how you learn, and that's how you know it's safe. And that's because doing is much more important than just learning theory. And the opportunity to do is what I think we need to do more sharing on that. Yes, there's certain breaches that I have rules for, that to make the birth safe. One of them is educating the woman. That's what a midwife should do. She needs to educate the mom, give her some choices, have the mom do some homework, have her realize that maybe she should have her breech baby standing up. Maybe she'd have her breech baby on her hands and knees. All the options that would maybe facilitate the birth, not just lying on your back, and not just depending on the midwife or the doctor to do all the maneuvers, that a mother can aid herself. She has to have confidence in the process, of course. If the midwife is nervous and the doctor's nervous and the mother's nervous, then it's something that nobody should do. You need to do it with confidence, relaxation, and caring. And sometimes that, again, I just have to say, you have to go to those births. You have to get the opportunity to be present at the moment and to see how it was handled and how it was done. So you could watch a lot of things on YouTube. If you can't see them if you watch, the mind is a funny thing. If you see something over and over and over and over again, pretty soon you adapt and you get confidence in it. So if the best you can do is to watch a bunch of breech births on video on YouTube, that's how you're going to gain your experience. And that's how we learn things. There's only two ways to learn things. One of them is constant spaced repetition. So if you continually watch a lot of breech births over and over and over, different ones, different situations, then you will gain that confidence. I don't really know how else to. I know you've had training in the maneuvers. I know you've had training in the process. I know you understand how the pelvis works. But to gain confidence, you need to see how wonderful and how babies just slide out most of the time. You will run into a problem maybe 1% of the time, even with a breech. And maybe you also could learn how to turn a breech. If you're not the confident to really do a breech, or the mother doesn't want to do one, you could learn then the maneuvers on undoing an external version. So all I can tell you is become involved to evolve. The only way you're going to be confident doing breech is to become involved in watching them, attending them, or seeing them. The same thing with twins. When you have twins, you have to understand, maybe you don't do twins right away, but if there's a twin birth in your area, try to find a way that you can attend so that you can share. You have to educate the mom. She has to want to have her twins vaginally. Some mothers, they don't. They don't want to. You may want her success or her a better birth, maybe more than she does, because she's fearful. The biggest job of being a midwife is to educate and help your mother gain confidence in herself. She has to have confidence in herself, and in her heart, she has to have that this is what she wants to do. And then you have to find a way to help her do it. And that's where your confidence comes in as a midwife. I really, I do twins. I've done twins underwater births. I've done twins, on hands and knees. I've done twins with the baby head down, and one was breech. I've had to turn babies, but I didn't jump in and do all that by myself. I did it again with an older midwife or with a doctor that has experience with it, and I attended births. And by doing that, I gained the confidence to do it. I can't, it's like riding a bicycle. You can see somebody ride a bicycle and you can fall off the bicycle 3 or 4 times, but you have to learn to do it yourself. And you gain confidence by hanging out with a more experienced person and sharing their births. You have to learn to share with each other. There's no competition. The joy of being a midwife is that we help each other, that we enable the mother to feel confident, that we enable each other to feel confident. Maybe I should just open this up to questions and tell me about some of your experiences that you've had or that you would like to share with everybody so we can all learn. Can someone give me some questions?
Yeah, very good idea. If you have any questions, you can write in chat box, or you can turn on your camera and ask to give you access for your voice to ask by your video. It is a fantastic time to share your experience. Gail Johnson has experienced more than 40 years, and I, as her junior student, more than 20 years. So we were engaged with these twins and breech birth hands-on, and tried to manage it very cool with patience and very confident. So try to share your experience. All of us as a midwife, we understand each other, and we are trying to manage our industry with our experts and sharing and learning from each other. Please, if you have any question or any experience or any doubt, you can write in the chat box and you can ask questions. In our previous classes, our midwives, they had so much fear about twins and breech birth. As you know, in some countries like Iran, India, and some Middle East countries, still breech and twins birth are not allowed to go for natural and spontaneous birth in hospitals, because most of the OB/GYN doctors, they are not supporting this case, and they call this case as a complicated case. So the countries who running their own private birth center, they are more optimistic and they are more welcoming to do breech and twin birth. So here, we are together. We want to learn from each other how we can be independent midwives and manage these cases independently by learning from each other. If you have any idea, I know some of you had this kind of birth during your work and your experience.
Did nobody have a lady that just came to the hospital and it was too late? The baby was coming out, breech? Did nobody have that? Wow.
Nobody had this experience, but we had this in Abu Dhabi and in Dubai and even in Iran. We had one twins, and it was IUFD in Karachi, in Kamali Hospital. When mother reached to the hospital, she was already 8 centimeters dilated. As I told before, most of the time we are not allowed, sorry, I don't know, we are not allowed to accept any breech or any twins case for normal spontaneous delivery. But because the mother was in active phase of labor and she was 8 centimeters dilated, the doctor could not manage her to send to the OT. So we tried to manage these twins on the bed, and they were IUFD actually. They were 28 weeks, very small size. And it was very easy birth without any hand and any interference. The baby delivered by its own. And we had other cases with twins, and we had twins with breech actually in Abu Dhabi hospital. When the mother reached to the hospital, she was already, the feet of the baby was in the vagina, and there were staff, nurses, and doctors were so scared because the first twin was with food. So there was no chance to send her to OT. That's why we stayed OT staff were available, but we let mother to deliver by her own and very easy without any force, any pressure. We let the mother to deliver by her own and by her own contraction. The only thing that I found from that birth in Abu Dhabi, sorry, voice is not clear. Okay.
We have Sarah, she has a question.
Oh,
Sarah,
yeah.
You can start your camera.
Sure. Yeah, please turn on your camera. Yeah. Yeah, so second baby, when it started for delivery of the second baby, mother contraction got off. There was no contraction for second baby. And most of the OB/GYN doctors became more stressed, and they were so tense. Why the second baby is not coming out and the contraction is off? They started some oxytocin or syntocinon induction to make mother more stimulated and get back the contraction. So this is
Go ahead,
experience.
please.
Yeah. Yes, please. Who wants to ask question?
Sarah.
Sarah. Okay, please, Sarah. You want to ask question? No. Yes, Sarah? Okay. So I think she doesn't have question. Just okay. So in these cases, just as a case study, if you see such these mothers in your birth center, or you are called for one home birth and you see this case, what you will do? If you be lucky, your twins will be both cephalic. But if you have some chance to experience some complicated case, you will see twins with first baby as a breech presentation. So,
well,
Sarah is written, they were little, so they got born easily. Yes, baby was 28 weeks. Yeah, first twins, they're born easily. So, if you mean if the baby weight be more than that, they cannot burn easily as a twins? Gail, what's your answer?
My goodness, I've had babies born that are bigger than that, my dears. Sometimes they were even bigger than the reason that they had the first C-section, and they still went on and had twins at home after a C-section. So I don't know what to say, girls. It's just, I have faith in birth, and I spent a long time catching babies with more experienced midwives. The way we train in the United States and Canada is that you are partnered with a more experienced midwife, even for home births. And remember, all my babies have been born at home. Some have been born in a birth center, which is really just a house that's been converted to a birthing facility. We don't have a doctor down the street. We don't have a doctor around the corner. We don't have an OB right next door. So when we have a mother that wants a breech or twins, what we needed was everyone to feel confident and everyone to support each other. And we needed people there that had experience in doing these things. And experience gives you confidence. So you do sound like what you need is to go to countries that allow or have a lot of breech and twin births and gain some experience. I don't really know what to tell you if you are not allowed to do them in the hospital. See, the interesting thing is, even the obstetricians don't know how to do it. So you have a chance as a midwife to perhaps gain some skills that obstetricians don't even want to learn. That's the interesting thing. They don't want to learn because they can just do a C-section. I cannot do a C-section. I have mothers that don't want a C-section. I have mothers that are educated in birth. I don't mean a formal education. I don't mean university trained, but they have taken the time to say, this is what I want to do. This is what I feel is safe. And she wants to be surrounded by people that will aid her and think the same way. We even have women now in North America, if they can't find a midwife and if they can't find a doctor, they won't go to the hospital and they will do their babies by themselves. That's how strong they feel about having a baby naturally and having a baby their way. So it's much nicer if a woman can find a midwife that will come to her home or attend her in a hospital who also believes as strongly as she does in a natural birth process. Ladies, no one cuts babies out of animals. No one puts them on their back and puts their legs in the air. We leave nature to do things the way that what is needed to be done happens. And most of the time, just as Lily said, if you leave a lady alone and let her body birth the baby, but everybody is at peace and doing the best they can, and sometimes the best they can is just hands off, things will unfold. Most of the time, 98%. Ladies, all I can tell you is babies are born healthy when mothers are all by themselves. Babies are born healthy. Have you seen those shows on TV where the mother didn't even know she was pregnant? Which I find kind of impossible, but she didn't. And all of a sudden she gets some pains and she has a baby in her own home, or because she didn't even know she was pregnant. Now, that baby grew perfectly. That baby grew healthy. That mother's body knew how to birth, and the mother didn't even know she was pregnant. Animals do the same thing. Maybe they know they're pregnant, but nobody helps them. But we make sure they're in a place, what? Where they've had good food, where they're safe, If you talk to any farmer or anyone that looks after animals, be that a cat or a dog, the thing is that you have to just leave them alone and let them follow the needs and urges of their body. And the babies will slide right out. So I don't know how to give you the feelings that I have, but I only have them because I've sat and seen the broad range of normal. Birth is a normal process for women. No one tells us how to have a bowel movement. No one tells us how to digest our food. We can put good food in our body and have a healthier body. We can educate the mother. We can facilitate the mother so that her birthing and her body will function with less stress. Stress is what causes all the problems in birth. Stress from the environment, stress from the family.
Exactly. Sorry, I interrupt you because the point that you mentioned is completely true. Because Fatima Qudsi is written that we have a twins birth in Iran. The first baby, it was cephalic and delivered already, and the second baby, doctors came to deliver. I want you to go to this point. If second baby doesn't come fast after birth, first baby birth, what we should do? Shall we be this much stress and do invasive work, start centers, that I want to hear from you. That what is the management of second baby if there is no more contractions and no progress of labor?
Well, I think nature wants the mother. Think about this, ladies. The first baby comes out. That baby maybe is crying or maybe it's not. And you do a little bit of neonatal resuscitation, but whatever. If a baby comes out and is crying, the second baby, I've had mothers wait 1 to 2 hours between babies. We monitor the heart tones of the second baby. We watch that the placentas, there's no bleeding. The placentas are not coming off the wall. And if the heart tones are good, we wait. I just talked with a midwife that waited 24 hours between babies. And I've read stories of people that had twin babies 1 week apart, a whole week. Now, I have not had that experience, and I'm not sure how comfortable what I would be with a week, but there are reports of that. But I have had many, many women that have at least 1 hour to 2 hours between babies. We monitor them, they get up, they go to the bathroom, they're holding on to one cord that has the cord clamp on it. And they go to the toilet and they come back and they kind of dance a little bit and dance the second baby down. But if the heart tones are good and no bleeding, then you wait. What is the problem? But if you get stressed and the mother gets stressed, then labor will stop. We all know labor stops when a mother is stressed. Animals do it all the time. They do. If you interfere with a mother, then it's, ladies, I'm going to say this, and you cannot have a sexual orgasm if you're having stress. Birth is an orgasmic experience. You have to have the mother in a place where she can make sounds, where she can use her body as she needs to use her body. But you can't limit it. You cannot say we have to get this baby out. Now, that's all I can tell you. You have to wait. But I guess in hospitals, if they have all these protocols, that's why so many women that are educated about a hospital birth experience don't want to go there. And it's getting so bad in some places that they don't even want a midwife because they can't find a midwife that's confident, that they'll rather do it by themselves. We don't want that for our women. I want women to feel safe and loved and cared for. And just in case I have some skills that might help her, I don't want her to have to think that she has to birth by herself. It's very sad, ladies.
Yeah, that's so sad. Sarah is asking if the first baby born, for the second baby, maybe cervix get closed.
No,
And
no,
so what
does
we should
not
do?
happen. Does not happen. Does not happen. No, the cervix stays open. No, it does not close. It's an elastic thing. It might collapse a bit, but it's still been dilated. It's still open. It's still soft. It's like, you know, the baby comes through the cervix. This is not the vagina. The baby comes through the cervix the same way. And when the baby's out, it relaxes, but it doesn't seal up again. No, it doesn't.
Great. Thank you. I think Khadija wants to share her story in Persian and I translate to English.
Okay.
It is okay خدیجه میخوایم به فارسی بگیم من کوتاه بگین که من بتونم ترجمه کنم. Yes, share your experience. Yeah, can you please give access to Khadija? Unmute Khadija, please.
سلام هم دکتر، وقتتون بخیر.
بله، قربون شما، مرسی.
زنده باشید.
بفرمایید.
هم دکتر در رابطه
کوتاه بگین که من کوتاه ترجمه کنم.
در رابطه با تجربه اینکه خودم یک زایمان دوقلویی رو تجربه کردم، چون من هم دکتر میگم که توی تحصیلات زایمان بودم و کیسای اورژانسی زیاد می اومدن اونجا. بعد با اورژانس یک موردی رو برای یک مورد خانم باردار آوردن و خوشبختانه حالا فول بود موقعی که اومدن تحصیلات. پزشک مرکزمون به من کانسالت که کردم گفتن که باید حتما اعزام بشه، ولی مورد جوری بود که رپچر ممبرین بود، وضعیتش جور بود که استیشن پایین بود. بعد یعنی قشنگ میشد این زایمانش رو بگیری. توی استونویشون نوشته بود که مثلا قول اول سفالیک هستش و قول دوم بریج هست. به خاطر همین خیلی پزشک متخصص منو به قولن یعنی فشار آوردن، گفتن که این حتما باید اعزام بشه. ولی موقعی که من خوشبختانه زایمان قول اول رو گرفتم، خب بعد دیدم توی اکزمم دیدم گفتم که این مورد یعنی قول دوم هم چیز هستش، سفالیک هست. با پزشکمون از دوباره کانسالت کردم. خب میدونین که هم دکتر اصلا توی ایران نمیذارن متاسفانه ماما بخواد یعنی یک زایمان دوقلویی رو میگیرین. خودتون دیگه این رو دیگه واضح دیدین هم دکتر. من از اون طرف به قولن یعنی یه شجاعتی دیگه به خرج دادم اینجا و با قاطعیت گفتم که هم دکتر بریچ نیست قول دوم، سفالیک هستش. و خوشبختانه من میگم که قول دوم هم خدا را شکر به دنیا اومد و هیچ مشکلی پیش نیومد. من فکر نمی کردم، چون هیچ تجربه ای از زایمان دوقلویی رو هم دکتر من نداشتم و واقعا توی یک چیز به قولن یک موج استرس زیادی بودم. هم نگران جان مادر بودم، هم نگران جان بچه ها بودم. از طرفی میدونستم که اگه این مورد بخواد اعزام بشه بین راه ممکنه مشکلی پیش بیاد برای بچه ها، اونجوری خطرناک بشه، چون دیگه وضعیت رو من جوری میدیدم که مثلا استیشن پایین بود، رپچر ممبر هستن، همه چیز برای زایمان مهیا بود. که من این تجربه رو توی تحصیلات زایمان بدون اینکه پزشک چیزی هم در کنارم باشه خدا رو شکر داشتم. و بله.
Very good. Merci Khadija. Khadija, she was working in primary health center in Iran. Iran in some, I can't say some villages, we have a small primary health center that's running by Midwife. And if you have some complicated cases, you have to refer them to the city or nearest facilitated hospital to the doctors or surgeon. So she had a case, there was a mother when she reached with complaint of pain, she was fully dilated, and her ultrasound report was showing that she has a twin. First baby is cephalic and second baby is breech. So she got confidence because she was thinking if she wants to refer this patient, this mother, with ambulance to the nearest hospital, maybe mother delivered the baby on the way and it will be more risky. So she accepted all of the responsibility and delivered the baby, the first baby, in the hospital, in this primary health center, against of her support gynecologist, because she was not agreed to do this birth there because the second baby was breech presentation according to ultrasound report. Anyhow, she accepted all of responsibility and she did manual exam, found second baby is cephalic, so she could convince the doctor for managing her birth in that primary health center. Thanks God, both baby delivered spontaneously without any invasive medicalized birth. Plus, she was so confident after that. She says, it was the first experience. I was not even know what is breech delivery or what is twins delivery, but thanks God, with all of God's help and support, without any gynecology support, I could deliver these babies and they were healthy. Thank you.
Very good. Excellent. See, that's marvelous. Now she's your expert contact there in Iran, right?
Yes.
Now,
yes, exactly.
if you get a lady that wants a home birth or a clinic birth, she just has to drive to this lady and have her baby there. That's all.
Exactly.
And she brings her midwife. Well, okay, let's say they're 2 hours apart. The next lady that has twins that wants a birth, you contact this girl that has had experience. You tell her when you go into early labor, we're going to get in the car, we're going to drive to her clinic, and we're going to share the birth. And I'm going to learn as the new midwife, and you're going to show me because you've done twins and now you have confidence. The mother has confidence in you. We all, and that's how you teach. That's wonderful. You just have to open your heart and say, if you have twins, bring them to me and I will share and teach. That's how you do it, ladies. That's marvelous.
That's fantastic. Bravo. Bravo.
That's what you do.
We are so proud of you.
Yeah, you have somebody now in your own backyard that you can contact, that you can talk with, that she can teach. She can share her experiences. And sometimes you have to fudge things a little bit, you know, you just have to say, well, she was visiting in our village and she went into labor and so they brought her to the clinic. You know, you have to be a little, so you don't get yourself in trouble, right?
Just need to be brave.
Yeah. And it's oh, that's so marvelous. That's how it grows, ladies. That's how we share with each other. That's how we teach each other. Exactly. That's how we serve women. You did it. She did it.
That's how we empower each other. Midwives empower each other with sharing knowledge and experience. Otherwise, we would not be this much competent and confident if we want just to go according hospital protocol, because hospital protocols is all OB/GYN written. So we will be back of the birth. Otherwise, we have to do something and empower each other. Sarah is written, what should I do to remove the scar of section? A scar of section? How you mean the scar of section? How to remove the scar of section?
I don't understand the question.
I don't understand too. Fatima is written, I have the same experience like Khadija. If you like, I can share it.
Yes, share it. Because you can teach too. They can bring them all to you.
Yeah, Fatima, you can. So after that, we will go for neonatal resuscitation. You have many doubts about how to resuscitate babies. And we as midwife, we should be very competent in neonatal resuscitation with very simple and very, very accessible facility in home birth. That girl will explain to you how easily you can manage neonatal resuscitation in your home birth. I think Fatima is not available. Okay, let's go to the next part and about your question about NRP. If you have home birth, and it was question of many of you, shall we go for syringe pump? Is it needed for syringe pump? Or in the hospital birth, most of us as a midwife, hospitalized midwife, we are scared to do very fast resuscitation for the baby. Is it needed to do resuscitation for any normal babies? Gail,
No.
over to you.
No. Oh, ladies, you're also wonderful, but the hospitals make you also afraid so much. If a baby comes out from a long labor and sometimes it's just tired or it's been a hard labor, or if she's had some drugs in labor that have caused the problem, most of the time it's the hospital that's causing the problems. Induction causes problems, we all know that. Epidurals cause problems, we all know that. So the things that we're doing are causing the problems. So if a baby comes out tired or is not breathing, you have to feel the cord. If the cord is pulsating, put your hand, just grab the cord and feel it. If the cord is pulsating, the baby's getting oxygen from the placenta, the same as it did before the little body slipped out. Nothing has changed. So you have what we call at least a golden minute. And a minute is a long time. Get yourself a stopwatch or look at your clock and try to hold your breath for 1 minute. It's a long time. Most people can't do it. But the cord will keep pulsating for 1 minute, 2 minutes, 3 minutes. It's called delayed cord clamping. I was taught when I became a midwife, never cut the cord. Let the cord give the baby the extra blood that's still in there because it's got iron and good red blood cells to help oxygenation. So all you have to do is leave the mother still attached to the baby, pick up the baby, and if you want to use an ambu bag because you don't want to use your mouth, then you can use the ambu bag right there on her tummy or right there on the bed. And most of the time, when you do just a little force of air into the baby's lungs, that will stimulate the baby. It will be primary apnea. It's not a problem. And then the baby will start to cry. Sometimes when the baby first comes out and you put it on the mother's chest, then you notice that the baby's not breathing. Sometimes all you have to do is take the baby away a few inches from the mother and it will cry because it wants the warmth and the heat of the mother. So sometimes you can rub the baby's back, you can dry it off, you can do their feet, you can do all of that with the cord still attached with the mother. That's the best thing. Once you cut the cord, now you've created your own troubles. You have created another trouble. If you cut the cord and the baby isn't breathing, now you must get that baby breathing. If you leave the cord attached, you have time. You have 1 minute, 2 minutes, depending on the baby. I can't stress this enough. Leave the cord attached. None of this 30-second thing. Leave it attached until the baby's breathing well. And you can do it beside the bed. Even if you have to do compressions because the heart rate goes down under 60, you can do them right there on the bed. Do not cut the cord and take it over there. Now, I know in hospitals, they're gonna, oh boy, you're in trouble because they want to take that baby over there. But to do that, they have to cut the cord. So they're causing their own stress. They're causing the baby stress. So neonatal resuscitation, I still prefer to use my mouth because it makes me feel that I'm connecting to the baby. And I've delivered babies in Africa, in very small mud hut clinics. I know other midwives that do this too. Most of us still prefer the mouth, but we're not afraid of bugs and germs now. So that depends on how you feel about it. But you can use the ambu bag with your hand for the baby, with the pop-off valve. So you cannot, if you get scared and you start pushing too hard, if the valve pops off, then you're not hurting the baby's lungs. When you do it with your mouth, you have to say to yourself, cheek air, cheek air. Your lungs are big. The baby's lungs are tiny. If you blow too hard, you can cause a pneumothorax. You can hurt the baby's lungs. So you have to just do like that. You have to, well, your mouth is open, so it's because you cover the baby's nose and mouth. So, but yes, you can do neonatal resuscitation with the cord intact, with the mom. And even if you have to do full CPR, you can do it all by the bed. And it's amazing. The family doesn't even know there was a problem.
Very nice. And can you please mention about how they can make a small, simple tray to keep the placenta, and how and where they should keep placenta for cutting the cord? About spontaneous.
Well, all you have to get if you're doing an out of hospital birth in a clinic or at home, all you have to get is like a cookie tray, and if you want, and you put a towel on it, and that gives you a hard surface right beside the bed. Or you can, if for the placenta, you can get a Tupperware bowl. You can get sometimes just the paper underpads. I just let the placenta be born on the underpad when the placenta comes out. Then I move it over there, and then I just put a clean one underneath the mother. So the placenta is not a big deal either. And remember, I don't do episiotomies, so I don't have. Sometimes I get a small tear, but yeah, we just catch the placenta and the in a bowl, or we just catch it with the underpads so that it's comfortable for the mother. Even if she wants to stand up and squat, if she wants to, yeah, she can stand up and squat on the bed, or she can get off the bed and squat on the floor and deliver the placenta that way. There's many ways to do that.
So there is no need for active management of placenta.
Not really, no.
If there is delay.
I don't know. I don't know what you mean by active management. You mean turning the cord and
sometimes we're using 10 units centrosinon as IM, or turning, or sometimes we have a small pressure on the pubis. Sometimes in some hospitals they said it's after the full baby birth, 10 minutes after the baby birth, you don't deliver the placenta, you have to go for active management of placenta. So this is the question I know most of midwives they will have.
No. Again, it depends. You wait for the separation gush. Sometimes you wait. What is the problem with the placenta being in there if she's not bleeding? Now, if you had a partial separation, you might get, if it's a partial separation, you may get a little more active, and you can do fundal massage and all that. But if she's not bleeding, the placenta has not separated. So if you pull on it, you could invert her uterus. You could break the cord. There's many things you can do by harm. But what we do is we put the baby to the breast, and we let the mother breastfeed the baby for maybe 20 minutes. That will make contractions. Sometimes we will massage gently, but we do not do any aggressive movement, especially if there's no separation gush, because we're just going to cause troubles. And once the separation gush occurs, sometimes the placenta just sits in the vagina because she's lying down, And all you have to do is ask her to squat a little bit, and the weight of the placenta will just come out. So, ladies, be kind, be gentle. This is her body. You don't be going in there and gouging and squishing, and that's not good unless she's having a postpartum hemorrhage. But that usually happens after the placenta is out, not to get the placenta out, right?
Correct. That's true. Most
And
of
I carry
manual, yeah.
Pitocin. I carry Pitocin. So I do have Pitocin in a syringe if I need to use it, and I just inject it. And because she's not hooked up to any IVs, so I just inject the Pitocin into the upper part of her leg, if I think I need that for to help the placenta after an hour, maybe. But I've had placentas in there for an hour, maybe longer.
Good. It was a very fantastic point. And one more question: how you prevent episiotomy and second, third degree of perineal tears? Which manner or which technique do you use, even for primigravida mother?
Well,
how we can prevent for long tears and episiotomy?
Ladies, do you know any animal that gets their bottom cut to get their babies out? Do you think that God just blew it with women? No. Yes, no, we don't do episiotomies. How you get it out is you don't tell the lady how to push. Let her push, especially when the head's coming out. She doesn't have to explode this baby out. She needs to breathe the baby out. We tell her when the baby's head's coming out, breathe. Let the body do it. Breathe. You don't even have to have her push. Just breathe. She can push until she gets to like a half a crown or full crown. But when the baby's coming out, you have her breathe the baby out. And also, don't put her legs too far apart. They need to be close together so that the skin, you don't want to do this and tighten everything. You want to put her legs a little bit closer together so she's got some loose skin so it can stretch here. We use sometimes oil, olive oil, maybe when you see just that much of the baby, we put olive oil on it so we can make it slippery and slimy and the baby can slide over it. Yeah, sometimes we put warm compresses on so that the mother feels the warmth of a warm compress. If she's birthing underwater, ladies, you cannot cut her because she's safe. She's underwater. And that's one of the benefits of a water birth, is it makes the midwife and the doctor keep their hands off of her. You cannot do so many vag exams. You cannot control if a mother's having a water birth. And so something in their heart is telling them that they're safe in there. And the woman will sometimes put her hand down and feel her baby coming out, but we tell her to breathe it out. And we don't get tears. And even if you get a tear, it'll be first degree. Might not even need to be sewn up. If you cut, you're cutting muscle. And if she tears, it's usually just the skin and the fat. So, ladies, just stop doing episiotomies and have the mom breathe the baby out. And if you want to support a little bit, you can. But again, ladies, the best midwife is the one that touches the lady the least.
Okay.
When a family comes to me, when a family says, well, you didn't do anything. You just sat there and told her and encouraged her and listened to the baby's heart tones for a couple of times. She says, but you didn't do anything. I said, aren't I a good midwife?
Exactly. This is sign of talent, and expert midwives should be calm, quiet, and just observe and support mothers. Most of mothers, even in Iran, I had a student, and even in Dubai, my student, they saw how we being relaxed and giving confidence to mother. Just the same girl says, let her just to breathe. You can have even premiscular with a mother without any needed for episiotomy and any laceration and even tears. So it depends to you how to explain to mothers and how to train them during pregnancy to make their breathe from their vagina, and they focus there and concentrate their breathing on their vagina muscle. It is very important to train them. They have some more questions. They're asking, okay, Sarah is asking, cutting cord late makes the bilirubin increase, doesn't it?
Makes what increase?
Bilirubin.
I can't understand that word. Makes what? Increase?
Yeah, cutting cord late. Does
Yeah.
cutting cord late increase bilirubinia
Oh no.
for the baby?
Bilirubin? Are you talking about bilirubin?
Yes.
No, it does not. That's the baby's blood. That blood that's in that cord going back and forth to the placenta. If you cut the cord early, you are depriving the baby of sometimes up to 1/3 of its own blood. It will be anemic. And if you have a premature baby, especially, the baby needs all that blood from the cord. You are causing harm if you cut the cord. The baby needs those red blood cells to oxygenate its body. And you will create anemia by cutting the cord before the baby gets all its blood back into its own body. So, because the baby's heart's sending that blood back and forth to the placenta, and if you cut it, you're trapping all that blood from going back into the baby. And that's why the cord goes white and collapses when you leave it alone, because then the baby is shifting its blood from going to the cord. It's shifting the blood to the lungs now, right? And so once the baby quits sending the blood through the cord to the placenta, it collapses because all the blood has gone back to the baby's body. So it will not it does not do anything about bilirubin, no, at all.
Thank you so much, Partner Rita. Gail, you are great. I'm really fascinated. Any more questions? Any more? If anybody wants to share experience, or if you have any question. Oh, Azade Zari, she's written, Azade, this is not related topic question. Anyhow, I will ask. She says if somebody, they have cesarean section and under skin, they will have some collagen part that will not inhale, and it still will be very
you're talking about it.
Yeah,
you're
they're
talking
talking
about
how to
adhesive.
remove no, they're asking how to remove cesarean scar, that bulging part that always after cesarean stay under the skin.
I don't think you can. Nope. And unless they're going to have some plastic surgery afterwards. But ladies, your body is supposed to. We have babies, ladies. We cannot have the young 15-year-old skin anymore. And you can't, you can have plastic surgery, but just to oil and things are not. And some people's skin heals better than others. Some people's they get more stretch marks. Other people get no stretch marks. No, if a lady has a bad like a bad scar from the doctor not doing the stitches right, it's pretty hard to fix. Yeah. By the way, I wrote a book, and it'll answer some of your questions on this. You can buy it on Amazon. So it's in English.
That is very nice. That's fantastic. Yeah, I tried to buy this book and you will learn too many midwifery tips from Gail Johnson. Okay, so if you have any more questions, let's go for the last question. اگر سوال دیگه ای دارین. I hope this panel would be beneficial for you. Anyhow, the day after tomorrow, next 2 days, 23rd, we will have another free online training. It will be about communication skills and about development management for midwives. Again, I invite all of you, and I will ask from our IT system to register you again as a free registration and attend our next free class. Plus, if you have any question, if you have any query, please write in your email. So thank you, Gail, for your valuable insight in this topic. Oh, they're asking, please say the name of the book. They want the name of the book. And they ask how we can buy the book. You can buy NASA from Amazon. You are in Kuwait, right? I think Amazon from Kuwait, you can buy from Amazon. Okay. This is Tales of a Traveling Midwife, written by Gail Johnson. Yes. Yeah, you can buy from Amazon. You can order from Amazon. Any more questions?
Okay, that's the one.
Thank you. Yeah, can you see? Okay, good. Thank you so much. Yeah. Oh, write in the chat box. Okay. Can you please write in the chat box? Book's name. Yeah. David, IT system will write for you.
Okay, you do that. I don't have a chat box. Well, maybe I do.
Oh yeah, it's okay. I will write. Can you write?
Chat. I can, maybe just a minute.
No, I'm asking from yeah. Can you show again the book? I will write. Sorry. Write exact words. Tell of a traveling midwife. Okay. And you can buy from Amazon. By Gail Johnson. Thanks a bunch.
Okay.
Welcome.
Yeah, it's
Thank you so much. I wrote in the chat box. So
okay,
for
good.
23rd, we will have again Gail and another. Dear girls, we are inviting you for our next class for 23rd with Gail Johnson and with Diane Lockhart, British trained midwife from Uganda. We go to talk about development management and risk management plus communication skills for midwife. And we have another event for World Mental Health 10th October. We invite you and all of your psychologist doctors, friends, and your midwives to attend that webinar as well. Please don't hesitate to share your feeling and your comments with us. And if you have any suggestion or recommendation, please let us to have your beautiful, valuable comments. Thanks again for joining us today, and we will see you again next time, 23rd, in the same time. Thank you so much. Please turn on your camera and let's see your beautiful face in the last moment. Please open your camera and let's have wave at each other, midwives from different parts of the world, from US, from Iran, from Kuwait, from Germany, and Let's see again from old Bangladesh, Florida. Thank you, Gil. Thank you so much. Have a nice day.
Have a nice day.
Joy. Love you.